So today's session is an introduction to the literature search and reference management using citation managers. So as I mentioned, it's an introductory session and it's not a very bulky session. So the objectives for today are simply to understand the importance of a literature search, the various types of literature searches and various databases through which we can conduct these searches. The next objective is to develop structured search strategies using Boolean operators. So don't get overwhelmed. It's just another word that we'll get to. And then the third objective is to understand available citation managers and how to use them. So let's get started with objective number 1. So why do we need to do a literature search? Why does it matter? So for starters, background searches avoid duplication of research. So you have your research idea, and we live in a community of researchers. Before you embark on that research project, it's good to conduct a background search to prevent duplication of research and thus prevent wastage of resources. Another reason why literature searching matters is to enable us to identify gaps in current knowledge. By knowing what knowledge is available, we can ask relevant questions, for instance, why, how, what, and identify gaps that are potential venues through which we can conduct research. Literature searching also supports generation of secondary data. So during the sessions with Dr. Parker and Gloria, you guys looked at different study designs, and there was mention of primary data and secondary data. So secondary data, right, is generated from a synthesis of primary data, right? So studies that were done, for instance, maybe controlled trials, cross-sectional studies, cohorts. You look at all of them, you synthesize, and then you generate a review. So what you're doing is you're generating secondary data. And what's based on the evidence hierarchy, right? We know that reviews, in particular systematic reviews and meta-analysis, are at the top of the evidence pyramid. And this evidence then informs practice. So in essence, there's a ripple effect. We need to do a literature search in order to avoid duplication of research, to do the appropriate research, and then to further generate secondary data, which will then inform clinical practice. So what are the different types of literature searches? Broadly, there's exploratory searches and systematic searches, right? Exploratory searches, from the name, involve preliminary or background searches. So currently, right, you have your research idea, you've written your concept note, and before you start doing this project, right, when you are writing your concept, you ran a search, like, has this been done in Kenya? Okay, it's not. Then you continue. So that's in essence what a preliminary or background search entails. There's also narrative reviews. So this is an unstructured approach. You just go search on a specific topic, and then you look through those papers and, in essence, synthesize or summarize what those studies have found. So the third type is a scoping review. This now involves checking both published and unpublished studies. Sawa. So this, what I mean, right? I didn't want to use the word, but I've put it down here. There's something we call grey literature. So sometimes, right, you've seen people writing editorials, reports, or putting their theses online, but these papers have not been published, which means they've not been peer-reviewed, right? Specialists, right, or like professionals in that field have not critiqued that study. So these studies are just out there. So scoping reviews sometimes include grey literature. Sawa sawa. So when you're writing your proposal, the type of literature search you'll be doing is an exploratory search to write the literature review section of your proposal. The other type of a literature search is a systematic search, right? It follows a particular framework using particular keywords, right, in a way that is comprehensive and can be reproduced by other people. So it typically does not include grey literature. So it's from systematic searches that we have systematic reviews, and then data from those reviews is analyzed via meta-analysis, and then, right, that evidence can inform clinical practice. So we've looked at why literature searching matters and the various types of literature searches. So how do we do these searches? We use various databases, and here we'll be focusing on public health and medicine. So there's PubMed. I'm sure all of us have heard of PubMed. It's open access, it's free, and it focuses on biomedical literature. There is Scopus, which is quite broad and includes not only the medical sciences, also technical and social sciences. There's Web of Science. It's comprehensive, also multidisciplinary. There's CINAHL, includes literature on nursing, allied health, healthcare as well. There's Google Scholar, which is broad and includes grey literature. So people's reports, editorials, and so on. And finally, ECAJS, which is European and focuses on pharmacologic literature and other medical studies. So usually we use PubMed, Scopus, and ECAJS for clinical studies. PubMed is free, open access. Scopus and ECAJS, however, are subscription-based, so some institutions have access to literature in them. So what I'm trying to say is a database, right, is a collection of libraries where published studies are kind of put to enable us to access them with ease. So we're done with objective number 1, and let's do a quick activity. So I hope everyone's got a device where they can access a search browser. I just want you to go to Google, nothing fancy, and do a background search on Google on your research idea. Once you do that on Google, then open Google Scholar. So a background search or a preliminary search, right, at this stage, you want to use general, easy access databases, and you want to use simple, broad terms. We don't want to use complex Boolean logic yet. I had these ideas as well. Maybe we can do one of them. So if you've got your research idea, you can work on that right now. So go to Google, search that idea of yours, and then see, is there available literature on it? Has a study been done? If it's not been done, has it been done in other countries? And what do those other papers report? Okay, so I'll just give you like a minute or so to do that, then we can do one together. So the goal of this search is to see whether your study has been done or not. If not, has a study been done in other populations? And if so, just to like do it on Google and then move in to do it on Google Scholar as well. So if you've done a search or are doing a search, you can react. So awesome. Okay, great. So let's run a search together. Okay, so I had a few ideas, but we can pick any one. So we can do the first one, comparison of kangaroo mother care versus standard incubator care on neonatal mortality among low birth weight infants in Kenya. So when doing a preliminary search, remember, we don't want to use many words. We want to keep it broad, right? So let's go to Google, I think. Okay, so this thing is bothering me. Okay, so let's do kangaroo mother care versus standard incubator care. Okay, so this is on Google, and we can see some studies have been done. So there's a study done in 2021. Okay, so I'm having trouble viewing the top of the screen because of that bar. Just gonna do this. Okay. So from our preliminary search, right, we can see that there have been studies done. This is a randomized control trial. So we want to see, okay, has it been done in Kenya? Maybe you're interested in doing this study. So we can see that there's no clear study. Let's look at this. Okay. So this has been done in Kenya. How kangaroo mother? But this is a report, right? It's not published. So what I like to do sometimes is look at the references, and it doesn't have any references. So what we'll do now, because Google doesn't make it easy for us to check what is published or not, we'll go to Google Scholar. And we'll see versus conventional, or what word were we using? Standard incubator care. Okay. So we're seeing a study in Nigeria, we're seeing a study in Uganda. Here. So impact of partial kangaroo mother care. Okay, this was done in 1998. Evaluation of kangaroo. So there's no study we are seeing done in Kenya, right, that has compared the two. There have been studies done on kangaroo mother care outcomes and so on. So from our preliminary research, we can see that there is no single study in Kenya that directly compares kangaroo mother care and standard incubator care. So this could be a potential study to embark on. So you can run the other ideas as well. I mixed studies that had not been done, and I mixed some that have been done. So during your free time, you can run a preliminary search on Google and Google Scholar. All right, so let's move on to objective number 2, how to build a search strategy. Now, a search strategy, right, is typically used for reviews. Sawa. For those of you doing original studies, right, you will not need to build a search strategy to write the literature review section of your proposal. But for those doing systematic reviews, for those doing review studies, it's important to build a search strategy. Remember, it should be comprehensive and reproducible. So how do we build a search strategy for such a study? First, define your research questions. There are various frameworks used. There is PICO, there is SPIDER, there is PEO, depending on the study question. Then identify keywords and synonyms. Use Boolean operators. So Boolean simply refers to something that has a true or false value, like it's either 1 or 0. So what we're going to do, right, is we're going to use the terms and or. So maybe things like 1, and like you want to look for, say, you want to look at kangaroo mother care in Kenya. So you say kangaroo mother care and Kenya, right? If it's or, you're looking for synonyms. So maybe if it's standard incubator care or conventional care or and so on. So or is typically used for synonyms and is used for appending two important keywords in your research question. Not, we don't typically use this. So we primarily focus on and or operators, but not is also a Boolean operator. And then apply filters, and finally document strategy for reproducibility. So let's get on to doing it, right? So this is an example of a research question for a review. What is the effect of author training workshops on manuscript submission in Africa? So this review, right, wants to look at whether training increases submission rates. So an example of a search strategy, right, using the PICO framework. So what does PICO stand for? P stands for population, I for intervention, C for comparator, and O for outcome. Okay, so let me pause there. Systematic reviews, right, they follow a structured way of doing things. And to come up with a search strategy that is broad, that is inclusive of everything, we tend to break our question into typically 4 parts using the PICO framework. So population, for example, where is the study being done? Here, it's in Africa. Intervention, what is our intervention? Author training workshop. What is the comparator? No training, for instance. Okay, and what is the outcome? Submission rates. So an example of a search strategy using Boolean operators, right, would be our intervention, research training, or author training, or scientific writing, or writing workshop, because this is all referring to one thing. It's all referring to our intervention, right? And then what is our outcome measure? And so we want studies that talk about trainings and also the outcome of the trainings. We don't want studies that only talk about the trainings. So, and publication or manuscript submission or acceptance, because these all tie up to the same thing. So, and our population, so Africa or sub-Saharan Africa, if you want to focus on this region. So what we can do is we can create a search strategy. So for those who are doing systematic reviews in this group, okay, just follow me as we create a search strategy. So when you search on PubMed, right, you can see the search bar, and then there's an advanced option here. So press this advanced option and you'll see this. I don't know whether you can see. Okay. So we'll start by entering a search term. So our first search term, right, is author training. And then we want to search for author training in study titles and abstracts. Okay, so what we're doing here, right, when conducting a systematic review, you want to collect papers that have talked about author trainings. So we will look for the word or the phrase author training in those titles and abstracts, right? If the term is a mesh term, you can check this mesh term. But for a broader output, you can use title and abstract. So author training, I'm going to put or what was our next term? Researcher training, sorry. So, or for instance, researcher training. Okay. Or finally, scientific writing or writing workshop. So for now, we can put writing workshop. Sorry. Okay. So we'll add it with or. So you can see in our query box, we've got the first component of our PICO framework, which is the intervention. So now if we search only this, right, we'll get only studies that talk about trainings, regardless of the outcome. So it's going to be unfocused. It's going to be too broad. We can see there's almost like 191,000 articles. So what we'll do is we'll put an AND operator. What an AND operator does, it narrows the search. Or is to broaden a search, and is to narrow a search. So we'll put AND acceptance or manuscript submission. So again, title and abstract, right? We put on manuscript submission. Okay, remember, we'll put with or because this is our second query, and then submission, publication, for instance. Okay. So if we search this, we're going to get loads of studies as well. So I want us to keep in mind that by using OR operators, we have broad searches. And then when we combine these three with AND operators, it'll be much narrower, much focused. So finally, we can put Africa. So, because that's our population. So I'm just going to put Africa. Since it's only one, what I'm going to do is I'm just going to randomly search this to save it. And I get a million things. So what we can do is add query, right? Add with and finally add with and. So what I'm doing here, right, is I'm combining these different queries. We had 191,000 from this, 141,000 from this, 526,000 results from this, and we're adding AND operators, right, the AND Boolean operators to narrow our search, and we'll search. So as you can see, we have 136 results, right? Looking at these words, author training, research training now. Okay, so I missed something. If you have phrases, right, what we do is we use quotation marks, because without quotation marks, then the words are searched independently. Okay, so no searches have been done which include Africa. So if we're to remove this component and search, we get a number of workshops, writing workshops, outcome of a peer review writing workshop, right? So this search shows us that there are no papers done in Africa, right? Looking at author training workshops and outcomes. These studies have been done in the West. So here you can see blah, 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 writing workshop, and so on. Okay. So far, I know I've said a lot of things, and it may seem like mumbo jumbo because it's like a crash course on searching. So if you're doing an original article for now, if you're doing maybe a cross-sectional study for now, don't get overwhelmed, right? This, you can take your time and learn when you do decide to conduct a systematic review. But for those doing systematic reviews, then I'm sure by now you have your PICO framework, and that is how you create a search strategy and you conduct a search strategy on PubMed. Any questions so far? Does anyone want me to repeat anything? Oh. Okay. So, yeah, they can write it in the Q&A. Perfect. Thanks, Gloria.
So someone is saying, what is a mesh term?
Okay. So mesh means medical subheadings. For example, you have a dictionary, right? Oxford English Dictionary. There are words that have been written in the dictionary, right? But then a new version comes out, right? And it has more words. So that's kind of like a mesh. It's like a library of words, right, that are easy to search, recognizable. But the downside of using mesh terms is it takes time to update mesh terms. So these are like known phrases that enable a standardized search. So you can look into it further, but simply put, they're just words commonly used in medicine that we can search with. Okay, please repeat how to add the Boolean operators. Okay, let me go back to it. So I think we can use the same example. I can just do it, sorry. Okay. So the good thing about PubMed, it saves your searches for that session. So how to add search terms? Let's pick another idea, okay? Let's pick this idea. Efficacy and safety, okay, I want something easier. Antenatal corticosteroids for reducing neonatal respiratory distress. So what we're going to do is, okay, and that is another problem with this. So let's do that. Let me look for that question. So let's create a search term here. So, what is the effect of antenatal corticosteroids on neonatal outcomes or mortality, for example, to keep it broad for now, in preterm births? So we have a new research question for a review, right? There's so many studies, control trials done. They developed, like, dexamethasone, betamethasone for us. Now we want to see, okay, is there really a benefit? So let's use this PICO framework. P, remember, population, right? So here we can keep it open. We can do global. Okay, intervention is corticosteroids, right? And we can focus on using DEXA and betamethasone. So C is a comparator, so no corticosteroids. And finally, O is the outcome. So we want respiratory distress. We want death, and so on. So of course, you can think of more, what's it called? Like synonyms. So let's create our search strategy. So corticosteroids, dexamethasone, betamethasone will use as synonyms. Sawa. And finally, respiratory distress, maybe hospitalization and death. So we're going to come to PubMed. Remember our advanced search builder. Here we want to focus on title and abstract. So we're going to come to our intervention, which is corticosteroids. So we're going to put dexamethasone, add with or, betamethasone, add with or. We're going to add steroid, add, remember, or is to broaden the search. We're going to add antenatal corticosteroid. We're going to put it in quotation marks. Okay. What can we add for corticosteroid in general? Okay, so this is the first part, right? The intervention. So if we are to search this, it will be quite broad because it's going to give us all the studies that looked at steroids, regardless of what they were looking at. So. And then we're going to put the second component of our search, right, which is the outcome measure. So respiratory, I'm going to put respiratory distress. We're going to add with or, we're going to put death, we're going to put or, we're going to put hospitalization, for example, we're going to add with or. What other outcome? Lung maturity, maybe we can put it. Okay. What else can I add? I can put that there just to save it. Again, it will be quite broad. 8 million results expected. And finally, our population is globally, we're looking at neonates, right? Because our focus is the outcomes of antenatal steroids. So we're going to put neonate or neonates. So we can put or, and we can even put neonates as a plural term. And what we can do is we can just add to history so we don't have to keep searching it. And then we can append. So what I did was add query. This is our intervention. The second one is add with and, because we want corticosteroids and the outcome, which is death, hospitalization, blah, blah. And then we add our population and neonate or neonates. And what we can do is we're going to search this. So you can see there have been a lot of studies, 4,600 studies that have looked at corticosteroid effects on lung maturation. So when doing a systematic review, right, and this is your search strategy, once you run it, these are your search results. What you can do is you can display all results. I think we can view how many papers there are. There are only, okay, so it's displaying all the searches up to 200. So what we can do is you can display up to 200, and then you can save these searches. So once you save these searches, then you can take them into Ryan and then run a systematic review on that. Okay, so all that for another day when we're focusing on systematic reviews. Today is an overview of literature review, and I feel like we're going into too much detail. So don't worry about this. Let's just come back to ground level. Literature searches include exploratory searches and systematic searches. For writing your proposal literature review, you'll typically be doing an unstructured search. So you can just search on Google and Google Scholar. You don't have to create a search strategy to write your proposal. The only time you want to develop a search strategy is if you're doing a review, right, using a structured approach. So typically systematic review, sometimes scoping reviews as well, but this is when we get to reviews. So we are done with objectives number 1 and 2, right? We looked at why it matters to do a search, various types of searches and various databases. And then we kind of had an insight into how exciting systematic reviews can get and Boolean operators. So we'll proceed to the third part of today's session, which is citation managers. So as I mentioned earlier, we live in a community of researchers, and people find different things and report different things from their studies. So what citation enables us to do, right? It enables us to quote what people have done, what they've reported, and to give them credit for doing that study, right? So that's what citation typically entails. I'm citing someone means I'm basically paraphrasing or summarizing what they found in order to aid my study, in order to maybe provide more robust or a more comprehensive and understanding of that matter. So citation managers are simply like applications, software applications for storing, organizing, and citing references. And they also enable collaboration and reduce citation errors. So you found this in a paper by Natalia et al., saying that betamethasone was associated with decreased neonatal mortality. And then another paper in Nigeria said that, dexamethasone had comparable outcomes. So when you're citing, if you're doing it manually, right, one, it's overwhelming. Two, you may end up causing errors and causing false citations, if I may, or not attributing correct information to the correct author. And finally, citation managers enable an ease of integration with Word, like with word processes like Microsoft Word. So, sorry, some of the population citation managers include Zotero. Zotero is free. It's open source. It's got a Microsoft Word plugin, and it's also got a browser plugin. There's Mendeley, EndNote, and RefWorks. So, sorry. So the most commonly used in our setting is Zotero, and that's what we'll be focusing on today. So I've got one more activity for you today. I think we can all install Zotero. Yeah. And then we can do an example by adding an article and then see how we can use it on Word. So that's it. Let me just go here. So I want us to download Zotero. Zotero. Okay. So download Zotero free latest version. Let's do that. Oh, it's on. It's loading. You can just press free download. So I've already got Zotero, as you can see here. But anyways, I'm just doing it so you guys can see it. Your download has started, as you can see, and it's saved. So in my downloads, Zotero. So I don't want to save this because I have it, but please download it. Once you've downloaded it, right, come back to download Zotero and download Zotero connector. Okay. And so you want two connectors. You want a web connector and a Microsoft Word. So what you can do is download Zotero connector for Word plugin. I can just come here and search that. So I hope we're together. Download Zotero, put it in your downloads, set up and install, and then get the Word plugin connector, right? So I'm just going to come here. The word processors supported, you can install. Okay, so I'm going to press this, right? Hopefully here. So we can go to the plugin if it's not working. And finally here, you can get the various plugins. And they've got a lot of details. So I'm going to give you guys 1 minute to do that. Download Zotero and the Microsoft Word plugin. You can also come here on the official website and download Zotero. If you download Zotero from here, you'll see, do you have Windows? Do you have a MacBook? And you can just download it from there. And you can get the Zotero connector. So I hope that's okay. Once you run Zotero, it pops up like that. So, okay, so I'm just going to give us 1 minute. I think I can just open a new folder there. Okay, I think I can just wait for you guys. Okay, so download Zotero. Once you download it, run it, install it, and it will pop up like this. Are we all together? Some reactions to know that we've got Zotero on our desktop, on our screen. If not, maybe we'll be able to do it later on our own. Awesome. So thank you for the thumbs ups. Okay. So once Zotero pops up, you want to come to this icon, new collection, enter a name for this collection. So what is your study? If your study is on antenatal corticosteroids, put antenatal corticosteroids. I like using like simple short words, corticosteroids. Okay, so I've got this folder. So all the references for my study, I will put in here, right? So I'm going to come here, right? I'm going to do, okay, for instance, this is one of the studies, hypothetically, right? So you're writing your literature review. So I'm going to do a dummy thing with you. So this is our study on antenatal corticosteroids on lung maturity, right? In Kenya. So this is our literature review. So in your proposal, in the literature review section, you'll have multiple subheadings. So assuming, right, the first subheading is effect of antenatal corticosteroids. So I'm going to put like a lot of, please accept this for now. I cannot think of a lot of statements to put right now. So let's assume, right, you have your section there, and then you come and you find a paper by Wynne et al., right? Okay, guys, let me show you another trick here. So these guys, they're only showing us their abstract. But if you want to see their whole paper, what you can do is copy this DOI, right? Please don't report me. Go to Sci-Hub and search. Go to Sci-Hub, okay, and search for the DOI. So DOI is just an identifier. So I'm just going to put there. Oh, it's not available. Okay, let's try another study. Anyways, stop laughing, you guys. Okay, let's try. It doesn't have anything. When was it done? Okay, so say this is a meta-analysis. Yeah, you can see it was published in Cochrane database. Let's look for this study. It's available. See, Sci-Hub works. Okay, so right on PubMed, they were only giving us the abstract. They were not giving us the full text, but we want to read this paper in order to generate our literature search, right? Because we're searching the literature. So we come to this paper. Oh, wow, it's quite intense. And maybe we see that their study, I want to see. So this is a meta-analysis, right? So they were basically summarizing studies. So there was a study, and I want to go to their here results, and finally let's go to the discussion. I want to keep this simple. Okay, so assuming, right, this study found okay, let me look for another paper that is not as bulky so we can just easily navigate through that. So let's pick this one, shall we? Again, Sci-Hub, thank you. Oh, said it too soon. Okay, I'm sorry, guys, but research needs patience, and we just need to be patient in our literature search. Okay. So I think we can just divert tangents and pick a paper that's available. For example, here, this one is available. So they compared kangaroo mother care with conventional incubator care. And assuming they found that the risk of hypothermia was reduced by 90% as opposed to this. So when you're going to your thing, now remember, we're not doing kangaroo mother care versus conventional standard incubator care. Please, I'm just using this for now. And do not copy paste. I'm only doing this so you guys can see it. So you can put like a study in Nigeria in, say, 2020 reported that the risk of hypothermia was reduced by 90%. This is rather than conventional care, with a relative risk of this and a confidence interval of that. So I want to cite them, right? What I'm going to do is I'm going to copy this DOI. Sawa. I'm going to copy this DOI. I'm going to come back here. You can see there's this new thing here called Zotero that has popped up. I want us to press Zotero. I want us to add citation. When you add citation, it's going to ask you what citation style. The most commonly used are Harvard and Vancouver. So you can pick Harvard. These other ones, you may need to add them and press OK, and you get this box. Oh, first we didn't add it. Sorry, I skipped a step, guys. Let me just cancel this. One minute. I just want to like put this and then I'll cancel it right now. So what we do after copying the DOI, we come to this, we put the DOI, we save the paper. So in our, now I'll have to rename this into KMC versus standard incubation care. And we've saved this paper, a comparison of kangaroo mother cane conventional incubator in Nigeria, Ibe et al. So they found this. I want to cite them. I'm going to put my cursor where I want the reference to appear. I'm going to press Zotero. I'm going to add citation, and I'm going to put Ibe et al. Or anything related to this. So you can see this study is here. I'm going to press enter. You can see this citation has automatically come. So you'll be like, I can do that manually. Why do I need Zotero for that? Well, because in a literature search, you won't just have one paper. You'll have like 50, 100 papers, and there's no way you're going to be able to keep track of them. And if you delete a statement, you'll have to manually update all of that. Another thing is that when you're adding your bibliography, if you press this, it's going to automatically generate this for you. So when you go to your references, you already have all the information about this paper you've cited without having to manually type it all. I hope that makes sense. Okay, so I'm going to repeat this once more. We are doing a study on comparing kangaroo mother care and conventional incubator care. Okay, we read this paper and we saw that they found that hypothermia, the risk of hypothermia was reduced. So if that is one of the things we want to mention in our study, right, we're going to be like, oh, okay, it was reduced by this. What we're going to do is we want to cite it. We're going to come copy. So just copy. Or if you go to cite, right, it's going to make you download this. I feel like it's longer. If you want to do it manually, you can. But the goal of today is using citation managers. So just copy the DOI, come to Zotero, where your folder is kangaroo mother care versus standardized incubator care. Go to this wand, this search, enter ISBN, DOI, PMIDs. You can even use the PMID. So DOI is just an object identifier. You're going to put that DOI there, press enter, and voila, this thing has appeared, this paper. I go back to my proposal. I have written this, maybe. So what I can do is I can update field. It's going to clear it. So I want to, for instance, I want to cite this. So I'll come back here. I'll come to Zotero. So again, this, I don't know why this keeps popping up. Okay, I'm going to come to Zotero, add citation. The study was by Ibe et al. I'm going to find it right there. Okay, and I'm going to cite it there. Under my references, oh my God, you guys didn't tell me I had a spelling mistake. References, I'm going to come to bibliography and it's going to automatically add it there. I hope that's clear. If there's something else, it was also reported maybe by Natalia et al. And then I want to maybe cite something or whatever this is, and then I want to cite it. I'm going to come back here. I'm going to come, maybe this paper was done by Natalia, hypothetically. I'm going to come to show more. I'm going to come to cite. I don't want to manually cite it though. Okay, it won't allow me to do that. Let me just see. Okay, here we are. So you can see the DOI also appears at the top. Okay, so you can just pick it from there, or if you want, export it. You can see it comes as a specific type. You can then open it as Zotero. So I don't know whether that makes sense. You can just come and try, but I think I'm complexifying things more than they should be. I think the take-home message here is copy the DOI, put it into Zotero, and then cite it. And get Zotero to generate the references for you. Any questions thus far? I've seen a few. Okay. Please repeat references on Zotero. Are we together? Okay, hopefully we're together. I can share a YouTube link on how. Okay. Please repeat how to use Zotero. Okay, let me do this again. I'm going to close this. I'm going to close everything I have. I'm going to come back here. I'm going to delete all of this. I'm going to delete this. Okay. Download Zotero. Okay. I don't know whether you need me to show you that as well. I can do so. That's okay. So download Zotero. You can come to their official website, maybe. You can see Zotero for Windows. So you download it here, press download, and it's going to start downloading. Okay. Once you download Zotero and you run it, and then you close Word and open Word again, you'll see Zotero in this navigation bar up here. Now you're doing a literature review and you're focusing on kangaroo mother care versus standard incubator care. And you found this study in Nigeria that reported that. So, so this was a study maybe that was comparing kangaroo mother care. Where is it here? Right? And you want to cite it. So copy the DOI. If you have the Chrome connector plugin, it usually identifies the DOI. And then you go to Word. When you're in Word, remember you've copied the DOI. It's on your laptop clipboard, right? And you've written what they found. You come and you add citation. Press add citation, or because you open Zotero, sorry. You have your folder. Oh my God. So you have your folder here. You copy your DOI, you put it in that folder. Okay. Once you put it in your folder, you see it there. Okay, so my laptop has decided to take it easy. Okay, there we go. So Zotero used that DOI to find all the information about the papers you can see on this side of the application, right? So we want to cite this. We read this in that paper, and we want to say that this study was done by eBay. We come to add citation. We can look for eBay, or we can look for the title. So for example, if I search kangaroo mother care, I can see this paper by eBay et al, sorry. I can put it there and it goes. And you can see it's appeared here. At the end of my literature review, in my references section at the bottom, right, I can add bibliography and it will automatically appear. All the papers I've referenced in my literature review will automatically appear in the bibliography if I'm to press bibliography. I hope that's clear. I hope that makes sense. It's quite simple. Thank you. Okay, finally, we did that. Clear, perfect. So in summary, Effective literature searching is foundational to public health research and research in general. It's important to choose appropriate databases based on your topic and your study design. So, for original studies, for proposal writing literature review section, chapter 2, typically you want to do a search on Google Scholar. You can do a search on PubMed as well. If you're doing a systematic review, you want to create a search strategy using Boolean operators, right? So it's comprehensive and it's reproducible. And finally, use Zotero to save time and improve referencing accuracy. That's all from me today. I've put these links for you to go check out. And it's now on to you. Create a search strategy using your topic of interest and run it on PubMed. So for those especially doing systematic reviews, go for it. Install Zotero. Hopefully we've all installed Zotero, and then attempt to do this on your own, on your side. Thank you very much for your time.